So in the preoperative setting, which we didn't get to talk about the ILD management there, so it was done in DB11 every 6 weeks while on therapy. In the DB05 approach, you pointed out some of the data that we heard here at ASCO. It's important to point out that the T-DXd can be given concurrently or sequentially after the radiation. I think we now have enough data to show that it's safe to do it either way. But it's very important to do that baseline scan, and then I believe it's after cycle 3, 7, 11. We want to continue to keep monitoring for ILD, and of course, allow our patients to understand how the symptoms may present and be proactive in asking them about any changes in shortness of breath, cough, dyspnea on exertion. Those are obviously signs to watch for, but I think the data that we've seen shows us that it's safe to give it either concurrent with radiation or sequentially.
Absolutely. And, you know, when we look historically at ILD rates, at least in the world of breast cancer, we are seeing somewhere around month 4 to 5 on a medium scale, but we can see it at any time, as we all know, that we can see ILD pop up at any time. And so it's always important to be vigilant about it. You know, is there some time frame in which you then space out the intervals of your CT scans?
Well, in the metastatic setting, I've been monitoring every 9 weeks. And then after patients get to a year, there's a curve that was shown that shows that at about a year, the rates do sort of plateau, but that's not meant to indicate that you should let your guard down, because there are cases that can happen even after that. But after a year in the metastatic setting, I would consider maybe spacing it out to every 12 weeks. But in the early stage curative setting, I'd be very careful about following the protocol that was done in DB05 and DB11. We're dealing with a curative population, and we want to make sure that we're monitoring patients appropriately.
Yeah.